Alpha blockers and beta blockers are two types of postsynaptic anti-adrenergic medications that prevent the respective receptors from being stimulated by catecholamines, like norepinephrine and epinephrine. The nervous system is divided into the central nervous system, so the brain and spinal cord, and the peripheral nervous system, which includes all the nerves that connect the central nervous system to the muscles and the organs. The peripheral nervous system can be divided into the somatic nervous system, which controls voluntary movement of our skeletal muscles, and the autonomic nervous system, which controls the involuntary movement of the smooth muscles and glands of our organs. This system is then further divided into the sympathetic and parasympathetic nervous systems. Now, the autonomic nervous system is made up of a relay that includes two neurons. We'll focus on just the sympathetic nervous system. Signals for the autonomic nervous system start in the hypothalamus, at the base of the brain. Hypothalamic neurons have really long axons that carry signals all the way down to the thoracic and lumbar spinal cord nuclei, where they synapse with preganglionic neuron cell bodies. From there, the signal goes from the preganglionic neurons down its relatively short axon, exits the spinal cord, and reaches the nearby sympathetic ganglion, which is made up of lots of postganglionic neuron cell bodies. The postganglionic neurons are also called adrenergic neurons because they release the neurotransmitter norepinephrine, which is also called noradrenaline, and to a much lesser degree, epinephrine, also known as adrenaline. These two catecholamines activate the adrenergic receptors on many different organs, which allows the sympathetic nervous system to trigger the fight-or-flight response that increases the heart rate and blood pressure, as well as slowing down digestion. This response maximizes blood flow to the muscles in the brain and can help you either run away from a threat or fight it, which is why it's called the fight-or-flight response. Now, there are two main groups of adrenergic receptors, the alpha receptors and beta receptors. Let's focus on beta receptors, which have two main subtypes, beta 1 and beta 2. Beta 1 adrenergic receptors are mainly located in the heart, where they increase the heart rate and contractility, which helps pump out more blood. Beta 1 receptors are also found in the kidney, where they stimulate a very special kind of cell called juxtaglomerular cells to release renin. Renin is part of the renin-angiotensin-aldosterone system, which increases sodium and water retention by the kidneys and helps increase blood pressure. Moving on to beta 2 adrenergic receptors, these are found on smooth muscle cells in the walls of blood vessels supplying skeletal muscles and the brain, which leads to vasodilation and increased blood flow to these tissues. In the lungs, beta 2 adrenergic receptors cause bronchodilation, and that increases oxygen delivery to cells. In the gastrointestinal tract, they decrease motility and slow digestion. In the eyes, they act on the ciliary body to promote the secretion of aqueous humor, which provides support and helps maintain the shape of the eye. Now in the liver, they cause more glucose to be released into the blood, and in the pancreatic islets of Langerhans, they promote the release of glucagon, which again helps raise blood glucose levels. Finally, beta 2 receptors stimulate an enzyme found on the surface of the cells lining the capillary walls called lipoprotein lipase, which breaks down triglycerides into free fatty acids and cholesterol. Alright, so medications that act on peripheral postsynaptic adrenergic neurons to block adrenergic receptors are called peripheral postsynaptic antiadrenergics. And based on the types of receptors they block, they're divided into two main categories, alpha blockers and beta blockers. Now, beta blockers are subdivided into three generations. The first generation of beta blockers are non-selective blockers, meaning they work as antagonists on both beta 1 and beta 2 adrenergic receptors. So here we have propranolol, timolol, nadolol, sotalol, and pindolol. Actually, pindolol is not a pure antagonist, but a partial agonist. That means that when bound to a beta receptor, it very weakly stimulates it, but at the same time, it prevents binding and stimulation by the more potent catecholamines. This is known as intrinsic sympathomimetic effect. Or more simply, pindolol has the same but weaker effects compared to the other first-generation beta blockers. Now, by blocking beta 1 receptors in the heart, these medications decrease the heart rate and contractility, which lets the heart work less hard and pump less blood out, resulting in a drop in its oxygen and energy demands, as well as a drop in blood pressure. At the same time, beta-1 blockade in the juxtaglomerular cells in the kidney decreases renin release, which in turn decreases angiotensin II and aldosterone, letting more sodium and water be lost in the urine and lowering blood pressure even more. Okay, but by blocking beta-2 receptors as well, they also cause some vasoconstriction of blood vessels supplying the skeletal muscles and the brain. This is typically very mild though, and doesn't have significant effects on blood pressure. In the brain, in fact, beta-2 receptors in blood vessels are only reached by propranolol, which is lipid soluble enough to penetrate the blood-brain barrier and induce some degree of vasoconstriction. Now, moving on to the lungs. Blocking beta-2 receptors causes bronchoconstriction, or narrowing of the respiratory airways, which obstructs airflow and lets in less oxygen. In the gastrointestinal tract, beta-2 blockade speeds up motility. In the eye, aqueous humor production decreases, so intraocular pressure, or the pressure within the eye, falls. Now in the liver, less glucose gets released in the bloodstream, and the pancreas releases less glucagon. So this results in a diminished blood glucose level. And finally, inhibition of lipoprotein lipase leads to the accumulation of triglycerides in the blood. Alright, so looking at the indications of non-selective beta blockers, they are widely used in the treatment of hypertension and coronary artery disease in the form of angina pectoris or a heart attack. It has also been suggested that beta blockers slow down the progression of congestive heart failure, or CHF for short. This remains controversial though, since individuals with heart failure often rely on sympathetic drive to maintain some degree of heart function. So in this situation, beta blockers might actually make things worse, especially in a situation of acute CHF exacerbation. Next, beta blockers can be used to slow down the heart rate in cases of severe tachycardia, like in thyroid storm, which is an acute, life-threatening complication of hyperthyroidism, where the body becomes very sensitive to the effects of excess thyroid hormone. For the same reason, some people use them in case of severe anxiety, like before giving a speech. Now, propranolol in particular has also been shown to effectively prevent migraines, a type of terrible headache, perhaps by altering the blood flow to the brain. And timolol helps reduce intraocular pressure when applied topically on the eye, which is why it's been used in the treatment of glaucoma. Now, side effects of non-selective beta blockers include bradycardia and hypotension, meaning that the heart rate or blood pressure may fall too low. Note also that in cases where someone quits taking them all of a sudden, they can lead to severe rebound tachycardia, hypertension, or even arrhythmias, meaning irregular heartbeat. There are also often complaints of fatigue, perhaps due to the reduced blood flow to the muscles, as well as dizziness, depression, insomnia, and nightmares, particularly due to the central nervous system effects of propranolol. Since they can cause wheezing, shortness of breath, and chest tightness, they are also strictly contraindicated in both chronic obstructive pulmonary disease, or COPD for short, and asthma. Sometimes diarrhea has also been seen. In other cases, there's hypertriglyceridemia, or increased blood triglycerides, and hypoglycemia, or reduced blood glucose levels. Hypoglycemia is the side effect to watch out for, as it may go unnoticed, since beta blockers blunts the counter-regulatory effects and symptoms of catecholamines, like tachycardia and tremors. That's particularly dangerous for people with diabetes who already take a bunch of other hypoglycemic medications, like insulin. Okay, now the second generation of beta blockers are selective for beta-1 adrenergic receptors, which is why they're called beta-1 selective or cardioselective beta blockers. Examples here include atenolol, metoprolol, bisoprolol, esmolol, and acebutolol. Like pindolol, acebutolol is a partial beta-1 receptor agonist, with an intrinsic sympathomimetic activity and weaker beta-1 blocking effects. Now, once again, by blocking beta-1 receptors, these medications lower blood pressure by decreasing the heart rate and contractility, while in the kidneys they decrease renin release. This makes them suitable for the treatment of hypertension, coronary artery disease, and cases of severe tachycardia, like thyroid storm and anxiety. Their use in congestive heart failure is controversial here too, but metoprolol and bisoprolol have shown fairly good results, so they're commonly administered. Due to the absence of the beta-2 blockade, they don't cause bronchoconstriction, so they can be safely used in individuals with COPD and asthma. They don't affect blood glucose as much, so they are the preferred beta blockers for those with diabetes. Bear in mind, though, that at high enough doses, these medications may also start blocking beta-2 receptors, so these individuals should always be carefully monitored. Finally, we have a third generation of beta blockers, which includes labetalol and carvedilol. What sets this generation apart is that except for blocking beta-1 receptors, these medications also block alpha-1 receptors in the blood vessels, which normally cause vasoconstriction. This makes them particularly useful in the treatment of hypertension, where vasoconstriction is a problem, like those with peripheral vascular disease. Labetalol in particular is the most commonly used medication for the treatment of chronic hypertension in pregnancy. And it's also often administered intravenously in hypertensive emergency, when the blood pressure becomes really high really fast, and there's also signs of end organ damage like the brain and kidneys. Carvedilol also has antioxidant properties, meaning that it decreases the production of free radicals and prevents thickening of blood vessel walls, which is beneficial in the treatment of heart failure. However, both labetalol and carvedilol have side effects of alpha blockade, like orthostatic hypotension, where there's a sudden blood pressure drop when the individual goes abruptly from lying down or sitting to standing up. Now, we want to make a simple and fun mnemonic that'll help you efficiently memorize and retain all these pharm facts. Okay, since beta blockers end in lol, let's put them in the LOL comedy club. Let's set up 3 stages for the 3 generations. All the stages are decorated with little hearts with knives stabbing into them to represent coronary artery disease like heart attack. The stages all have microphones with blood pressure cuffs wrapped around them for hypertension. Okay, so the first stage is labeled beta 1 and 2 for the receptors targeted by the first generation beta blockers. On this stage we have propranolol, timolol, nadolol, sotalol, and pindolol. So let's have a skit about a man named Tim for timolol, who's drinking a soda for sotalol. He's trying to fill his propane grill representing propranolol, but it's not going well. Frustrated, he pulls the pin on a grenade for pindolol and nadolol and decides to blow the whole thing up. Now, for drug-specific indications, Tim's so angry that his eyes are popping out, which represents increased intraocular pressure and glaucoma. On the propane grill is a mannequin head with a band-aid on it, since propranolol can be used to treat migraines. Okay, on the second stage we have the second generation beta blockers, labeled beta 1. Here we have an Eskimo performer for esmolol. His trick is that he can eat anything, for atenolol, and on his plate in front of him, there's a metal handcuff for metoprolol, a piece of bismuth for bisoprolol, and an ace of hearts for acebutolol. His assistant is an obese man with diabetes, and he's here to remind you that second-generation beta blockers are less likely to cause hypoglycemia and diabetes. Finally, there's an angry police officer on the stage who's missing his handcuffs. He's so upset that he needs to use his asthma inhaler. This will help you remember that second-generation beta blockers can be used in people with COPD and asthma, since they don't cause bronchoconstriction. Between stage 1 and 2, let's put some disorders that can be treated by both groups of medications. So let's have a tornado with little bow ties in it to represent thyroid storm. The stagehand is watching it anxiously to represent anxiety. Okay, moving on to the final stage labeled beta 1 and alpha 1, we have the third generation beta blockers. On this stage is a doctor in a lab coat for labetalol, and she's doing ventriloquism with a cadaver for carvedilol. The club owner is trying to wash away the smell with a hose that's shooting out red-colored water, to help you remember that these are the only beta blockers that cause vasodilation, and they can be used to treat peripheral vascular disease. For drug-specific indications, the scientist is pregnant to help you remember it's the drug of choice to treat hypertension during pregnancy. Her lab coat has ER on it to help you remember it can be used during hypertensive crisis. Now, for side effects, let's use the audience in front of each stage. By stage 1, we have 2 tables labeled beta 1 and beta 2. At the beta 1 table, we have a frozen heart representing bradycardia, and a man who stood up too quickly and becomes dizzy, representing hypotension. At the beta 2 table, we have a giraffe with a neck brace to represent bronchoconstriction, and there's a bunch of empty candy wrappers to represent hypoglycemia. Now at stage 2, there's only a beta 1 table, since these medications are selective for that specific receptor. Finally, at stage 3, we have the beta 1 table and also an alpha 1 table. The man at this table also stood up too fast and is feeling dizzy. This will help you remember that both alpha 1 and beta 1 blockage can lead to hypotension. Alright, as a quick recap, beta blockers are divided into 3 generations. The first generation are non-selective beta 1 and beta 2 blockers, which include propranolol, timolol, nadolol, sotalol, and pindolol. The second generation are selective beta 1 or cardioselective beta blockers, including atenolol, metoprolol, bisoprolol, esmolol, and acebutolol. Both first and second generation medications are used in the treatment of hypertension, coronary artery disease, and cases of severe tachycardia, like thyroid storm and anxiety. What sets them apart mainly are their side effects, since they may both cause hypotension, bradycardia, rebound tachycardia, and arrhythmias. But only the first generation causes skeletal muscle and brain vasoconstriction, bronchoconstriction, hypoglycemia, and hypertriglyceridemia. Finally, the third generation includes beta-1 and alpha-1 receptor blockers like labetalol and carvedilol. But wait, there's more! Here's a mind map with all the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. Stay tuned for the answers after the credits.
Calcium entry blockers, or calcium channel blockers, CCBs for short, are vasodilators, or medications that promote dilation of blood vessels. These medications are mainly used to treat hypertension, or high blood pressure, and angina pectoris, which is a pain caused by reduced blood flow to the heart muscle. Now, by definition, blood pressure is the force that blood exerts on the walls of blood vessels, and it's basically what keeps blood flowing and perfusing tissues to deliver oxygen and nutrients. Hypertension happens when this pressure is higher than it should be. In most cases, the cause is unknown. But basically, we can do a number of things to help lower the blood pressure. First, we can decrease the heart rate or the myocardial contractility, so the heart pumps less blood into the blood vessels. In other words, diminish the amount of blood that exerts force upon the same area. Or we can vasodilate the peripheral blood vessels, which increases the area for the same amount of liquid that exerts the force. Angina, on the other hand, is a type of chest pain caused by insufficient oxygen supply to the myocardium to meet its demand. Generally, the underlying cause is the presence of atheromatous plaques in the coronary arteries, which decreases the blood flow to the heart. So, to help diminish the symptoms, it's important to decrease the oxygen demand of the heart, again by decreasing heart rate or myocardial contractility, and increasing the oxygen supply by vasodilating the coronary arteries. Now, let's look at how calcium channels affect heart function. First off, the heart rate depends on the rate that the pacemaker cells in the sinus and atrioventricular node generate action potentials. These action potentials start automatically when sodium channels slowly let in a stream of sodium ions, which causes the membrane potential of the pacemaker cells to become more positive. When this reaches the threshold membrane potential, it's the cue for voltage-gated calcium channels to open, allowing a large influx of calcium ions, which depolarizes it further. Then, these calcium channels close and potassium channels open to let potassium out of the cell, so the membrane potential goes back down, or repolarizes. Now, each cycle of depolarization and repolarization represents a single heartbeat, so how fast this process repeats in 1 minute determines the heart rate. Okay, so now let's look at the cardiac muscle and the vascular smooth muscle contraction, which also depends on calcium. Voltage-gated calcium channels in the membrane of the muscle cell open when they receive an action potential, and this allows calcium ions to flow into the cell from the extracellular space. The extracellular calcium causes the release of intracellular calcium ions stored in the sarcoplasmic reticulum. All these calcium ions then bind to troponin regulatory proteins, which change shape and release the thin filaments into the muscle fiber. This allows thin filament to bind to the thick filament, eventually leading to muscle contraction. In the heart, this means greater myocardial contractility. In blood vessels, this means vasoconstriction. Okay, so calcium channel blockers, as the name suggests, block voltage-gated calcium channels. We can divide calcium channel blockers into dihydropyridines and non-dihydropyridines. Dihydropyridines include medications that end with the suffix -dipine, like nifedipine, nicardipine, amlodipine, and nimodipine. These medications act mainly on the smooth muscles of the blood vessels. Non-dihydropyridines include verapamil and diltiazem, which both have a greater effect on the heart compared to dihydropyridines, but are less effective for vasodilation. So let's start with dihydropyridines, which are mainly used to treat hypertension. They preferentially exert their effects on arterial smooth muscle, and nifedipine is the prototype of this class. Besides treating hypertension, dihydropyridines are also commonly used to treat other disorders. Since they can also dilate coronary arteries, they are effective for preventing angina. They can treat Raynaud phenomenon, a disease caused by vasoconstriction of the arteries in the tips of the fingers, causing them to turn white, then blue, and finally red. Lastly, they're used to prevent cerebral vasospasms after a subarachnoid hemorrhage. For side effects, dihydropyridines cause reflex tachycardia, which means that the vasodilation is sensed by the sympathetic system, which increases heart rate in order to maintain perfusion to the tissues. Fortunately, this reflex is triggered at higher doses than those needed to lower blood pressure. Next, vasodilation is also responsible for the side effects of dihydropyridines, like flushing, dizziness, and peripheral edema. Another side effect is gingival hyperplasia, but the cause is still unclear. Now, let's switch gears and talk about non-dihydropyridine calcium channel blockers, verapamil and diltiazem. These medications are highly selective towards the heart and are classified as Class 4 antiarrhythmics. They're particularly useful for treating arrhythmias that cause increased heart rate or tachyarrhythmias like atrial fibrillation and atrial flutter. Verapamil is more cardioselective than diltiazem, making it the more potent antiarrhythmic. Next, both medications also decrease myocardial contractility and provide moderate dilation of coronary arteries, so they're also used for treating angina. Now, diltiazem is more effective than verapamil as a vasodilator, although not as effective as the dihydropyridines, so it's a better antihypertensive. Since non-dihydropyridines decrease the heart rate and contractility, they are contraindicated in people with bradycardia and heart failure. In fact, they can cause bradycardia as a side effect. Other side effects are constipation and hyperprolactinemia, or a high concentration of prolactin in the blood. Now, let's make a simple and fun mnemonic that'll help you efficiently memorize these pharm facts. So, let's start with a river full of milk to represent the calcium entry blockers. On the left side of the river, we have the dihydropyridines, and on the right side of the river, we have the non-dihydropyridines. Since the dihydropyridines are more selective for blood vessels, let's put a flag on this side with a big artery on it. On the non-dihydropyridine side, let's have a flag with a heart on it, since they are more cardioselective. The dihydropyridines all end with dipene, so let's put a giant bowl of bean dip under the flag. There's a blood pressure cuff wrapped around the bean dip, since their main indication is for treating hypertension. Now, this bean dip contains some extra protein in the form of body parts, which will represent the other indications. There's a bleeding brain in the dip for subarachnoid hemorrhages, a heart with a knife in it to represent angina, and finally, a severed hand with pale, white fingertips to represent Raynaud's phenomenon. For side effects, let's have a rabbit with a heart-shaped spot cautiously approaching this bean dip to represent reflex tachycardia. It's blowing a big bubble from the bubble gum it's chewing to represent gum hypertrophy. Let's give it big red cheeks to represent flushing. So now let's go to the other side of the river for the non-dihydropyridines. For verapamil, let's use a rapping vampire. For indications, there's a bunny with a heart-shaped spot who's playing the drums off beat. This represents tachycardia and arrhythmias. By the vampire's feet, there's a heart with a knife through it to represent angina. For diltiazem, let's put an oil drill by the river. Now, it shares the same indications as verapamil, but since it's closer to the left side of the shore, it also causes moderate vasodilation, so it's effective in treating hypertension. So let's wrap a blood pressure cuff around it. For side effects of the non-dihydropyridines, let's put a toilet to represent constipation. There's a frozen heart on the toilet, which represents bradycardia. And finally, let's have a cow licking the frozen heart for hyperprolactinemia. Alright, as a quick recap, Calcium entry blockers are divided into dihydropyridines and non-dihydropyridines. The dihydropyridines mainly target the smooth muscles inside blood vessels and cause vasodilation, so they're used to treat hypertension and angina. The non-dihydropyridines are more effective at targeting the heart, decreasing the heart rate and contractility. They're classified as Class 4 antiarrhythmics and are used to treat tachyarrhythmias. However, they can also be used to treat angina since they decrease cardiac demand. Some non-dihydropyridines, like diltiazem, even have a moderate vasodilatory effect, so they can also be used to treat hypertension. But wait, there's more! Here's a mind map with all the mnemonics from the video. Go ahead and pause the video so you can test yourself and see what you remember. Stay tuned for the answers at the end.